It's happening. My apologies. Hopefully everybody can hear me. What we here for? Hold up, caller should. There she go. Wait a minute. Where she go? It'll be here. She don't have problems. Let me see. There she
There you go.
go. All right. My bad. My bad.
Yeah.
My
Yeah,
bad.
yeah, yeah.
My, my bad. My bad to the people. Um, yeah, I got to, doing these virtual consultations. I was like, damn, I was like, I got 5:30. Don't have 5:30. It's 5 o'clock. My bad.
Yeah,
My bad.
you definitely said 5 o'clock.
I did say 5 o'clock. Look, posting stuff and they ain't even following through. My bad, people.
Yes,
All right, let's get
all
in.
right.
Let's get into it. Let's talk about it. What we got?
All right. Well, welcome everybody. I know it's been a while. It's still within the same month, but it has been a while. So I know a lot of y'all was in my inbox like, when is the next one? I'm pretty sure they probably was hitting you up too.
Mm-hmm.
So as usual, this is our monthly live free game session. So if you have a question tonight, I have some that were already submitted. Thank you for waiting patiently. If you want to ask a question, please drop it in the question box. So we watch the comments on the screen, but when we talking back and forth, it get confusing. So it's easier for me to go to the box with the question mark. So that way I could record it, I could save it in case we don't get to it, depending on the time allotment. So please, if you have a question, put it there. And then as always, you can join in person and ask your very own question if you wish. And then that way you kind of get like a free consultation on the spot. Anything else?
There it
If
is.
you don't know who I am, those of you who are joining for the very first time, I am one of Dr. Johnson's patients. I actually had minimally invasive surgery for fibroid treatment 2 years ago. So I actually took everybody through my journey the whole way from beginning before surgery, first doctor visit. I explained how I looked up my surgeon, how I interviewed other doctors, and I went all the way through the process. I shared all the spears, everything. And ever since, we've been doing this once a month because a lot of people had questions. So this is your chance to ask my doctor or the world's doctor, not just my own personal doctor, but I ain't got that kind of money yet. But this is your chance to get to ask your own questions. So if you can't come see him on your own, you can definitely get some guidance for yourself, or this is your chance to interview him so you can make a decision if you want to be able to use him.
I don't necessarily have some of the first questions. I don't need my own set of images. Any other images are fine. MRIs, ultrasound, is fine. So I don't necessarily have to do the image myself. I'm not territorial like that. Images are images. They don't really dictate how surgery is going to go or whatever. They give me an idea of what you have, help me give you your options, and then from there the rest is on me. So yeah, images are images. It's
I
cool.
see you, AT. Yes, he's your doctor too. Whoever want him to be the doctor. I ain't got all like I said. I ain't got the money for private doctor service yet. All right. So I got definitely some that was submitted. So I'm gonna go back and forth. Um,
And I got
definitely
to, and I
have.
got to. Somebody told me yesterday I have to put all of our lives in the thing in the group, like the live grouping, to where you can like just hit a button and see all of our lives and
Oh,
see like your whole journey. Like I need to organize my stuff because everybody like, oh, how did I get this? How do I get this? I'll be like, just scroll back.
yeah.
But
People
I
don't
need
want
to
to do that
organize.
because
My
definitely
bad. Now, if
they reach
anybody
out
wants
to me
to
and say, "Can
help
you
me,
send me the video with this?" So I
right?
be having to do the scrolling and go find which one.
Yeah, I
Now some
gotta.
of them I can't remember what we asked in every live. I said one day when the bandwidth allow, I'll go through the YouTube and try to put it down, but I don't have that. And then like I don't remember everyone, but I am trying to get better.
Shit,
All
yes to
right,
me getting organized. I feel you. It's hard work over here. Struggling.
man.
Trying.
Time just be life in.
Life be life in me. Jesus.
All right. So, first question. What are the long-term complications of endometriosis if I have not been successful treating it naturally?
It just depends. So there are different stages of endometriosis. So 1 to 4, it just really depends on how extensive the endometriosis is. If endometriosis is very extensive, meaning that it's outside of the environment of your pelvis, it's going to, your bowel, your, ureters and things like that. It can really get crazy. Then it can cause you major problems. Infertility is a huge one. Um, you know, people get infertile from endometriosis just depending on how bad it is. Not to say you can't get pregnant again, but if you have extensive endometriosis, pregnancy is going to be difficult. But pain, bleeding, scarring, all of those things are significant um, risk factors for chronic endometriosis that goes untreated.
Okay, and I'm gonna just ask this one too because it's kind of related.
So
Um,
the facilities that I operate at primarily are Mount Sinai Hospital in Chicago, Illinois, and University of Chicago Ingalls, which is in Harvey, Illinois. So, which is basically Chicago too. So, those are the two hospitals that I perform my surgeries at.
oh, can you also pin your information at the bottom of the?
Yeah.
Thank you. All right. Is endometriosis a very common condition, and why does it seem so difficult to diagnose?
It can be very difficult because sometimes you can't see it. It's like you usually, when you do laparoscopic surgery, you're able to see those lesions, but you it's possibility that if you go in there and you don't see them, you can still it doesn't mean that you don't have endometriosis. The biggest way to really diagnose endometriosis, the quick and cheap way to do it is to try a 3 month trial of hormone suppressants, whether that be birth control pills, whether that be any type of hormone suppressant. Now, the more suppressive the drug is, the better it's going to work. Like, i.e., like Lupron, which is like king of kings as far as like suppression is concerned, it's going to make your pain better. But even things like, birth control pills, Depo-Provera, whatever, even with short-term usages, things get better. So if they get better, then now you have to find the treatment options that make the most sense for what you have. Some women have to have surgery first and then get on treatment. Some women can get by with just treatments. It just really just depends again on how extensive it is. But for certain, if you have extensive endometriosis, you're gonna have to be on something. Like, again, I'm all about holistic. I'm all about like medicines and things. Natural, holistic things or what have you. But if you got extensive endometriosis, you got to do something that's going to uh, significantly reduce your estrogen production by your ovaries. And it's not many herbs that are going to do that. You got to have something that's going to either suppress those ovaries or completely eliminate the ovaries, and that's where you're at. But there are other options. If it's not as extensive, then you don't necessarily need that. Um, so there's people trying to hop on here.
Oh, you know
See,
what? I think,
Loretta trying to get on here. Hey,
uh, yeah, I can't see the questions today because
why?
I think I requested you instead of you requesting me.
Nah,
So it's like
nah.
I'm a guest instead of you inviting me. Normally
That's
I
you
can
talk
see
about
the thing.
the questions, the question bubble.
Yeah, so you're gonna have to put me out and put me back.
Okay. Um, all
Sorry.
right, no problem. Let me let you go ahead. All right, I'm gonna put her right back in a second. Hold up. Now she not popping up. Our name not even popping up. That's crazy. Oh, didn't even pop up in the search. Hold up, I'm gonna have to figure out how to get Cola back. Um, I didn't froze the woman out. Hold on. We'll answer all of these questions in a second. Moderator. Um, there you go. I think
There
that
we
should
go.
do it. There you
Okay,
go.
now let me
All
see.
right.
Can I look at the? Why does it say ask something for me?
I don't know. Don't worry, I'll read it.
You
So
know,
yes, I
Instagram be tripping, and it'll change something on me in a minute.
real quick. It's all good. So yes, I am based in Chicago. I'm gonna go through these real quick. Put these in a question bubble so I don't have to scroll through. Thanks again. Last question. Are polyps removed as well with the fibroids? Yeah, if you have polyp, well, I will say it depends on what type of fibroid surgery you have as far as the polyps and stuff are concerned. Um, it's possibility that you may not remove polyps if you don't do an extensively good job. Hold on a second. Take over for a second, caller.
Yep, I got you. All right, so if you just joined, welcome. We are doing our monthly live where you have the opportunity to drop your questions in the question bubble at the bottom with the question mark. That way I can go back and forth. If you're not able to do that, then some people have submitted questions already, so I'm actually going back and forth through a running list on that. And then also, you can send a request to Dr. Johnson yourself to actually join the lab. And then once you join, it's almost like you get a free consultation on the spot. So you can't beat it. It's free game. Talk about it to Thursday, I
All
guess.
right, look, everybody don't be mad at me, don't shoot me, but I gotta deliver this baby. It's gonna be like super quick. I'll be back. Let's resume this as 6. Um, I hate to cut everybody off, but if y'all just really stay patient, I'm gonna go do this and I'm gonna come back and then we're gonna answer all of these questions or whatever. So
Okay.
make sure y'all come back. It's gonna be about 6. I should be done. All right, and come back.
All
Okay.
right. I
All right.
got you.
So all right.
Go
So
go save the baby.
I'm gonna end this 6 o'clock. Be right back. Okay.
All right.
All
All
right.
right. We'll be back.
All right.